I'm doing just a further away inspection of the face, looking for just any initial impressions I have. Okay. Alright, I'm seeing some freckling in the cheeks. Does that happen all year round? Okay. Does it tend to happen more in the summer months?
I think so.
Okay. Everything looks really healthy. I do see a bit of flaking right here in the forehead and the nose, so that's some of the dryness you're talking about. I have some treatment for that as well, so we can go ahead and explore different ways to remedy that. But the dryness it's not too extreme. Okay. I'm going to take a closer look here. Just with my magnifying glass. Okay. Some areas that I just want to measure. Just some dry scaly patches. Okay. Do you use a SPF?
SPF 30.
That's really good. Is it on your foundation or just your moisturizer?
My moisturizer.
Okay. All right. As long as you're using that daily, it's a pretty good sign. Okay. I'm also going to be looking at your scalp and your hairline today, so I'm going to be starting with the face, but I just want an initial impression of your hairline. So can I just grab your hair here and just smooth it out? That's perfect. All right. Okay. Okay, your hair follicles look healthy. Again with this instrument. Okay. I'm not seeing any damage or breakage. Your hair looks pretty clean. I don't see any over oily patches here, so that's good to know. Just going to be doing some preliminary measurements of the face just to look for symmetry. Okay. Okay, that's 5. Right in the center, so pretty symmetric here. Okay. And nose to here. About 5. 3.5. 3.5. Some asymmetry is normal, as long as there's not too much variation. Just seems like there's none here. Okay, we have a 6-inch, just a ½ inch variation from the ear to the chin. Just gonna measure the circumference of the forehead. Okay, so it's about 12 inches, the whole be about 24. Okay, these are all healthy and standard measurements. I'm not seeing any alarming signs of swelling or just lopsidedness. Okay. Alright. Let's sit right here from both sides of the chin upwards 1 inch. 3 inches. Okay, did see a couple moles on your face, so we're going to be doing just measurement of those just to have for records. Okay, let's see. Okay, this is symmetric, 1 millimeter in diameter in circumference. This is a 1 millimeter on the right side, right through here. Okay, this part right here, just barely ½ millimeter, and symmetric on the forehead. Okay. Alright. 2 millimeters by 2 here. Alright. Okay, just one here. Okay, that is about 3 millimeters by 3 millimeters. And then one here on the left side, which is a 2 millimeter diameter. Okay, so just a few light moles. Have any of these popped up recently, or have you all kind of always had them?
I've always had them.
Oh, okay. I'm going to do some palpations and percussions of the face, so let me know if you feel any pain, okay? Pain here?
Mm-mm.
Okay. Pain along the jawline? Okay. No palpable lymph nodes, which is good. Not seeing any signs of swelling. Okay, I'm going to feel underneath the eyes and the sinus cavities. Okay. Okay. No signs of swelling or discharge. Just going to feel right beneath the ears. Okay, healthy and normal. Going to feel on the side. Okay, it's healthy and normal. Feeling along the temples and just underneath the eyebrows. Okay. Alright. The chin. Okay. Okay. feels good and normal so far. Going to be performing a couple sensory function tests to make sure the nerve endings in your face are responding appropriately to certain sensations. Okay, so this is going to be a soft sensation, and this will be sharp. Do you kind of feel the difference?
Mm.
Okay, go ahead and say sharp or soft.
Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. Soft. Sharp. 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 Soft. 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 Sharp. Soft. Sharp. Soft. Sharp. Sharp. Soft.
Okay, that's very good. Okay. Okay. And as I slide this tool all the way from your chin to the top of your head, let me know if you feel it all the way.
Mm-hmm.
Okay. And from the bridge of your nose to the ear, do you feel this all the way?
Yes.
Okay. And same here.
Mm-hmm.
Okay. I'm going to be gliding it along the line of your hair. Let me know if you feel it all the way, if there are any areas that feel more numb.
I felt it all the way.
Okay, very good. Okay, and if you could describe this temperature, what would you describe this temperature as?
Cold.
Okay, and is it cold on this side as well?
Mm-hmm.
Okay, how about here?
Yes.
And down by your chin?
Mm-hmm.
Good. All right, so it's a tuning fork. I'm going to be making a vibrational sensation, placing it on different parts of the face. Let me know when you stop feeling the sensation, so just say stop or now, whichever one you want.
Now.
Okay.
Now. 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 Now.
Okay. Excellent. So to help with your moisture issue, I have a advanced serum that's really going to help with hydration. I'm going to apply it strategically in certain areas of the face that correlate with organs of the body. Okay, so I'll be applying them with a brush and maybe adding a little bit of pressure point therapy just to instill the areas that I choose. Okay?
Mm-hmm.
It's going to feel a little cool. All right. Okay, so we're going to start with right underneath the eyes, and that really correlates to aiding in liver function. So if you ever feel like your liver is in need of detox, in addition to a healthy diet and supplements such as milk thistle, you can just massage underneath the eye. The under eye and the liver are connected. Okay. I'll do it on the other side. Sorry about that.
Okay.
Okay. And this should just help with circulation as well. Okay. Just giving a little bit of pressure point. Okay. 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 Next section of the face is your heart and your lungs, which are here and here. So I'm going to be patting down the area on the cheek here, which is connected to proper heart function. And then your lungs are right here underneath the apples of the cheeks. Again, the heart is right here. Okay, and then you have your lungs. Okay. Alright. And then the colon is right here between the corners of the lip and the jawline. So this is good for proper bowel movement and digestive function. Okay. Okay. And right by the forehead is your gallbladder association. So I'm going to be dotting both sides of that. And of course, this also helps to moisturize the skin and some of those dry scaly patches that I saw. Okay. Okay. And your stomach. It's right here in this dry scaly patch. If you're having issues with stomach cramping or the occasional nausea, I wouldn't be surprised because this area right here seems to be irritated, and that can manifest in the face in this manner. So just patting in the treatment here. Okay. And just stimulating pressure points on the forehead. If this feels like too much pressure, just let me know. Okay. Okay, and your spleen is right underneath the nose here. I'm just going to dot that very gently. Just stimulating those organs to maintain activation. Alright. And dotting with the pressure point tool. Okay. Lastly, on the chin, we have your bladder and kidneys. So, if you're having any issues with dehydration, frequent urination, this is a good area to pay attention to. I don't see any issues that come up here with the skin, so probably have a pretty good healthy and active bladder and kidney. Okay. Just slowly dotting that area. Okay, alright. And lastly, surprisingly enough, I'm going to be just brushing the ears. And this relates to your muscle system. If you're trying to build muscle, experiencing atrophy, any issues related to your musculoskeletal system, it does connect to the ears. And I'm not seeing much dryness here, but it's always good to just keep hydrated because we often neglect the ears when it's a part of our hydration routine and our lotion routine, so it's always good to instill that. I'm going to be applying some pressure point therapy here. Let me know if it's too much. Okay. I'm going to get the other side. Seeing a couple blemishes on this ear, so I'm going gently around them. This serum has arnica gel, hyaluronic acid, and aloe, so all very natural occurring elements combined with more medical based molecules. Just gently patting that. Okay. And applying the pressure points. So next I'm going to do the scalp exam portion of this, okay? I didn't find any major issues with the skin, but I'm just going to be brushing the scalp and just finding a part to look at. Put these areas apart. Examining the scalp here. I'm seeing a bit of sun damage here, which can be easy to incur, especially because we normally don't wear sunscreen on the head. But there are lots of sprays you can use that would help with that. Also, just wearing a hat outside during the summer can be really beneficial just to stay on top of preventative care. But for the most part, I'm seeing pretty healthy skin. Okay. Couple of red patches I want to measure, but nothing too severe. A lot of healthy moisture up here, which is good. That means your oil glands are working properly. Okay. All right. Just going to measure some of the areas of redness here. Just a millimeter here. And the red patch is a little bit bigger. It's 2 millimeters in diameter and circumference. I'm on right by the hairline, which is 1.5 millimeters. Okay. So, especially because you're so fair, I would just caution to use sunscreen on the head, and wearing a hat I think would help, but I don't see any horrible damage that's alarming at all. Just something, just natural. Okay. Just going to take a closer look at the hair itself. Okay, I don't see any lice. No dandruff. And your hair looks pretty strong, no breakage. It's on the thinner side of normal. Does that cause any issues for you? Okay. I just examine here the hair. Examine the ends of the hair. Alright, no breakage, no split ends. It all looks very healthy to me. So, I don't think I missed anything. Just going to do a couple of abbreviated sensory function tests. The scalp can be harder in terms of sensitivity to operate than the face. Okay, so I'm not going to do a sharp or dull test. I'm going to just touch you with a sharp object, and just when you feel it, say yes, okay?
Yes.
Okay.
Yes. 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 Yes.
Okay, and continuing.
Yes. 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 Yes.
Okay. Okay. And so this is just a little air puffing device. And I'm going to be applying it to the scalp and the face. Okay, and I want you to know if you feel this sensation once, twice, or 3 times. Okay, so just say 1, 2, or 3. Okay.
1, 2, 1, 1, 1, 3,
Good.
1, 2, 3, 2, 1, 1, 1, more,
Okay.
2, 1, 1, 1, 3, 3, 1, 2, 1, 1, 2, 1, 1, 2, 2, 1.
Okay. lastly, I'm just going to apply a tiny bit of the moisturizing treatment to the scalp. Just because I did notice a tiny bit of redness, but nothing to be worried about. Okay? Okay. Press out. Tori. So that concludes our session for today. Hopefully it helped. I'm going to send you home with a bottle of the solution that I applied to your face and scalp. Apply it twice a day on top of whatever skincare regimen that you have, and I think it's going to help with a lot of that dryness, especially during the winter. But other than that, your face and skin seem perfectly healthy to me. So thank you for coming in today.
Awesome. Thank you so much.
Okay.